Thanks for tuning in to Inspiring Women. I'm Laurie McGraw. Every week, I speak to inspiring women who share their stories of how they are making an impact on the world. This week, I'm speaking with Dr. Suchi Saria. She is a prominent healthcare expert in the areas of machine learning and AI. And you're going to hear from Suchi talk about all this excitement in terms of what's real, what's hype, but also what is the real opportunity with AI in healthcare. She sees a future where there is the opportunity for an explosion of diagnostic tools that can aid clinicians in swift detection to a diagnosis, reducing the time to get to improved outcomes for patients, getting rid of a whole lot of waste in healthcare, giving clinicians back time, therefore helping with burnout, and a whole lot more. Again, please do subscribe to Inspiring Women to hear more of these stories, but now let's hear from Suchi. This is Inspiring Women, and I am Laurie McGraw. And today I am so excited that I'm going to be speaking with Dr. Suchi Saria. Now, she is the founder and CEO of Bayesian Health. She is a bona fide, absolute expert in AI and machine learning. Bayesian Health is an AI machine learning platform company, which is really aiming to help physicians make better decisions at the point of care using AI and machine learning. We're going to talk about that. In addition to her many peer-reviewed articles, her many years of research, and many of the things that she's done, she has been well recognized for her work in AI and machine learning. She has degrees from Stanford University. She is a professor at Johns Hopkins, and she also is advising the FDA on AI and machine learning. And Suchi, thank you for being on Inspiring Women.
Thank you so much for having me, Laurie.
Okay, well, let's go. So we always get started on Inspiring Women talking about sort of like, what are you doing right now? So Suchi, I mean, beyond the work that you do at Bayesian and the FDA and Hopkins and on the speaker circuit and, hoping keeping Mickey Tripathi like on task at ONC, which I appreciate. What does day-to-day look like for you? Why don't you give us a sense of what your day-to-day is?
I think I wake up at about 7 a.m. Actually, really, if I was being super honest, I probably wake up at 5:30 a.m. every morning. And very naturally, my brain fills up with thoughts of like all the exciting things that are happening in AI and health. And I know this is going to sound totally cheesy because I feel like I wish I had a life where I could think about more things, but it's just so exciting. There's so much progress going on in AI, has been for the last 10 years, really more. And then the use of it in digital health, it's like blown up. People are just so thrilled and see ways in which it can be used. So I guess my early morning often starts with, there's things I've been thinking about that's been on my mind. I've rested for like 5 to 6 hours. I wake up, I'm thinking about like, okay, what am I going to conquer today? What needs to happen? And then from there, I'll spend like 10, 20, 30 minutes with my husband. We'll drink coffee together. And very often my meetings start from about 7:38. My schedule is quite brutal. I love it though. Work is play, play is work for me. So it really doesn't feel like I'm working very hard, but I'll often have, 8, 9, 10 hours of meetings. A lot of these meetings are creative, problem solving. People are coming to me with all sorts of problems, whether it's, on the technology side, they're trying to solve something and don't know how to think about from Bayesian, my team members, or, trying to think about, on the validation or study design or clients and talking to hospitals and health systems on challenges they're facing and how Bayesian can help solve it. All of the above, just like learning from all sides really is sort of, and then eventually the day sort of, I close my emails and at some point have dinner with either friends or my husband, or, we go out. It's New York City. Every day is an adventure in New York City. So, it's like a vacation every evening. You get to experience some part of New York City and think, and I travel a lot. So some days it's travel and, watch some comedy show at night. I love comedy. It's very fun. It's very creative. It's often storytelling. And that's the end of the day. As I'm saying this, I'm realizing I really need a little bit more diversity in my life.
Well, you are so focused on technology, and we're going to talk about obviously AI and machine learning. And, I will just say, myself, I have a degree in cognitive science in the Wayback Machine and took my first AI course, back then. And it was just a very futuristic idea and only sci-fi movies. And now I don't actually think we're at the height of the hype cycle, but we are definitely starting to get there. But I think it is due to what we're really seeing, which is progress and actual work, and particularly in healthcare where there's so much opportunity. So let's go there, because that's where you are absolutely an expert, and you started your work at Bayesian in the area of sepsis. So maybe just let's talk about Bayesian. So what does Bayesian do? What is an AI machine learning platform company, and how can it impact healthcare?
Yeah, absolutely. Let me first start with, why the name Bayesian? Because I'll sometimes get asked, by technologists, is it Bayesian because of using Bayesian techniques? What is Bayesian? So for physicians, sometimes they've been when they've been in school, they've taken classes and they remember sort of the statistics and the gimmicky things they had to learn. And so it brings back memories, right? So the whole idea with Bayesian thinking is the way smart humans make decisions is, as you get data, you integrate these different types of data. You have some notion of trust. You trust some things more than others. And as you get new data, you may make a forecast, but you update it over time. And you're continuously thinking about both what you think it is, but also as new data comes in, how to do the update. So that's sort of optimal decision making, right? Everything I'm describing here is how clinicians, physicians, nurses, like caregivers are ideally in this very rich data world are operating. The very best clinicians are often operating this way, right? They're looking at what's happening, what have we seen thus far, therefore where should I collect more data, therefore what should I integrate, and therefore how should I update my differential diagnosis in order to help make the right decision for this patient. Bayesian is essentially operationalizing that in this insanely data-rich world. In the last 10 years, we went from almost no data to huge amounts of data to a place where it's painful. There's data and information stuck in notes from this encounter, prior encounters. How do you bring that all to life in a way where, you're also seeing sicker patients, you're having to do more with less. 1 in 3 nurses are leaving the workforce. You are burnt out. And the solution has to be some form. I mean, isn't it amazing if there was a way technology could bring all these different types of data together, intelligently parse it, surface the right set of information in a way that is extremely easy to use and understand, and then bring it to life in the context of the decision you have to make. So suddenly it's saving you time. You were going to try to think through it, go click, 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 click to the EMR, identify, synthesize, then try to make a diagnosis, then treat, and then you're trying to make sure. So let's take sepsis as an example. In sepsis, we know one of the most promising avenues for improving outcomes is early detection and timely treatment, right? The problem is, and so here's a great example. And, back in 2015, when I first started working in this area, showed you could use machine learning with all the data that exists in the electronic health record to be able to pretty accurately identify early patients at risk. So if you can do that, now suddenly you can have, systems that are parsing all this data, identifying precisely and accurately, surfacing it within workflow. Clinician sees a flagged patient, they can open it up, they can see why you flagged them, they can then evaluate, treat, and give, the relevant items like treatments like lactate and blood culture and antibiotics, source control, any kind of escalation that needs to happen, which makes it then really, really easy for them to do the right thing. Furthermore, document it. And so what that does is saves them time.
Where does the AI and machine learning come in? And Suchi, just to go in the Wayback Machine, I've been in healthcare a lot longer than you. And when we started working in the EHR business, we would always talk about that, every month it seemed there was 7 years worth of peer-reviewed journals that physicians needed to, assume, into their intelligence to make the best clinical decisions. The EHRs were going to solve that, which they obviously did not. We were not talking about AI. We were not talking about machine learning. We were just talking about electrifying, the documentation systems, which is what the EHRs became. So what is specific about machine learning and AI that makes that optimal sort of like accumulation of data at the right point in time now available? EHR certainly did not solve that problem.
Yeah, great question, Laurie. So what is AI/ML good at? It's good at, and first of all, there are different types of AI/ML. There are different types of tasks. So very simply, people are seeing ChatGPT as an example, and I want to make sure people understand, right? Like ChatGPT was created as a way to generate new data. So it's taken a huge amounts of data, synthesized it to learn what kinds of words go together. And then the AI is optimized to be able to spit out the best next word given the last paragraph that exists. And so what it means is it constructs a lot of sentences. It's not grounded to be factually correct, right? Because the whole thing it's trying to do is just kind of learn about, it's kind of like a very intelligent person who's just watching you say things and then mimicking you. So that's one type of AI. In this kinds of AI we build or we have to build, it has to be clinically, grounded.
Relevant.
And that's where the huge amounts of papers you said comes in. So during the development process, we're taking data from millions of patients. We're identifying, let's go back to the sepsis problem, right? We're identifying patients who had sepsis versus who didn't. We're looking at what the onset time was from when the earliest indicators were obvious to clinicians when they started treatment. Now we can learn from that data what were the earliest indicators that we can identify that separate the cases who had sepsis from the ones who didn't? And we can even bring in very nice knowledge that is well understood in biology and medicine around how different indicators are expressed or medications might express indicators, and build that all into a system that is able to incorporate known knowledge and learn from data in order to start accurately identifying and learning. And the cool thing about this approach is now, let's imagine you had a data set with 1 million patients, all sorts of scenarios in which patients showed sepsis, like, maybe it was older patients, maybe it's patients with chronic kidney disease, maybe it's patients who just had surgery, maybe it's patients who have, burn patients or trauma. You can start to learn much more precise, accurate, population-specific biomarkers that bring these data together. And so as a result, they can be much more precise. They can learn over time as new data comes in. You can query to understand the why, make it easy. And then one of the most important things is there are types of AI where it's closed, like a closed box. What I mean by this is it's fully autonomous. It's basically doing its thing all on its own, entirely start to end, trying to give a diagnosis. The area where I think there's enormous impact to be had is when we can augment our frontline clinicians, which means we can assist them in doing their job a whole lot faster and a whole lot better. So what I mean by this is when we're able to parse all this data and present it, they don't have to go click, 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 click. They can quickly see what was relevant, but confirm and evaluate on their own, which now both saves them time, but also make sure they don't miss patients. And that's really valuable. And then do the documentation that is necessary, which AI can totally assist with. So it saves them just a huge amount of time.
Yeah, and I think just to, in terms of the area of sepsis, people may or may not know this, but, sepsis, the onset of sepsis is life-threatening. It is fast-moving. And if you don't detect it early, I just lost my mother-in-law, and sepsis was the ultimate thing, beyond a well-lived life and old age. I know that you have a family member, and this is part of your early work and interest in solving these problems, but that early detection is so key. And if you think about that frontline clinician, the amount of sort of data that is available to them for them to parse through all of that. These systems are confusing. They're large, they're complex. And if you talk to any physician, they will tell you exactly how many clicks to get to anything of importance to care for their patients. So this is exciting. And I think certainly the paper that you put out, Suchi, with your colleagues at Bayesian in Nature was groundbreaking in terms of really showing us the efficacy and opportunity with AI. But we also know that there's a lot of hype right now Again, I don't know if we're at the top of the hype cycle. Chat GPT has given us all a lot of, and I actually have a question from you for chat GPT for the one time when it didn't crash and I could get on it. But where are we in that? What are the key things in terms of the opportunity? Are we really, how can I tell what is hype? How can I tell what is real? What should I look for as a consumer, as somebody, a receiver of healthcare, or looking at different data systems out there?
Yeah, excellent question, Laurie. First of all, I think there's excitement and there's hype. So the excitement is the good part. The hype is what sort of like derails, actual real development, right? So one thing that's really, really cool is I actually think we made so much progress since the Watson days in terms of the core technology itself, the application of the technology itself, that's allowed us to demonstrate real results in peer-reviewed studies, like rigorously conducted, that demonstrate efficacy. We also have like a host of new investigators, entrepreneurs who deeply understand healthcare and deeply understand technology. Because healthcare is just not a kind of field where you as a deep technologist can come in and make breakthroughs. It's just too complex. There are too many stakeholders. You have to understand the pain points, have deep, deep, deep empathy to be able to build solutions that really solve problems rather than make solutions that are distractions or extraneous or useless or a waste of time. And so I think there are basically very foundationally, we're just seeing more of the right types of teams. Like historically, people have thought, the big techcos understand AI. One thing that's very interesting is if you look at pretty much all the biggest results in AI, they've not come from the big techcos. They've come from small groups that were experts and super focused. Even very simply, like OpenAI that demonstrated ChatGPT as an example, those were fresh grads, like fresh out of school, who founded OpenAI, several years ago. So where I'm going with this is the first thing I would look for is not excellent marketing, but good teams where you have people with deep expertise in the tech and deep expertise in the domain. They really understand the problem space. They really understand what to build, but they also really understand the technology. The reason the two are important is because essentially the space is evolving so fast. You want teams that can go in and live problem solve. Even if they have products, you want the products to evolve and keep pace. And for that to happen, you really need teams that understand both sides. So that's really like the number one place where I see screw ups. I frequently see tech teams completely diminishing the problem domain, not having the necessary focus to really excel at it, which in healthcare is so essential. And then I also see healthcare teams without the deep technical expertise or the grounding to be able to really deliver the products you need. So that's really sort of one of the biggest ways to identify. And then second, track record, right? Like look for, not just the right story. Everybody can hear and tell the story. The question is, have they proven themselves? Do they have assets that demonstrate that they've really solved hard problems and proven that it works? In digital health, I think there's a, reproducibility crisis. Like we often, for me, coming from academia as becoming an entrepreneur, what was shocking is how much digital health takes place through a marketing deck. Like people put up a deck and then they start selling. And in the way we constructed Bayesian, day one was when we raised funding, we went stealth mode. We built the technology, we built the platform, we did like research partnerships with really, really good groups where we proved it out in prospective real world studies, not just small studies, but really large scale real world studies that really show you in rigorous ways, clinical validation, financial validation, stakeholder pain points. We get it. It works.
Yeah.
Then
and some
go
of
into commercial.
Those stakeholder pain points, just to sort of, put a plug, figuring out how to put these great new technologies and opportunities in the appropriate workflow for the clinician. And that for so many of these wonderful entrepreneurs out there is where brick walls are hit pretty hard, where technologies don't get absorbed, life-saving potential technologies, because they're not appropriately built into what are already complex workflows and then become burden. I'm sounding a little bit like, sort of a talk track from my AMA days, but still so important not to introduce new burden with the opportunity. Okay, Suchi, let's go back a little bit to you. So you clearly have a handle on what the opportunity is, and you're making progress, particularly in the area right now of sepsis. I know that you are looking at other disease states and opportunities there. Where did this interest come from? Did you originally, was it just technology all the time, just healthcare because of your personal experience with your family member? Where did it all start for you?
I think, well, my interest in technology just started in AI in particular when I was very, very young and just saw it was kind of crazy in retrospect that the younger version of me was so fascinated by it. But I love the idea of building smart machines that could think and, take data and parse it to be able to do intelligent things to make, my life easier. I'm sometimes a very lazy person and I want somebody else to help me do things and really help do other. So it was the interest originally started from the math and the science and the tech and the possibilities. But it was around 2007-8 when I got introduced at Stanford to the possibilities in healthcare. As I started to learn about electronic health records, Stanford was just implementing Cerner and Epic. It became clear that, we were, it was really like what felt like just hearing the stories as an outsider of like what data we were going to be collecting and the scale at which we were going to be collecting. It felt like crazy to me how we could operate without needing more intelligent technologies that could allow us to use all this data to make better decisions. So that was sort of really my entry point. It was also around the time when I was just going through a personal crisis where I felt I'd spent all my life doing hard things and I wanted to move from just doing hard things to doing things that really mattered. And this is, many technologists, like, we often grow up being fascinated by hard, but at some point, it was just sort of feeling like, got it. I think I know how to do hard. I feel like I've done it in a variety of different contexts. I don't need to prove myself anymore. I need to figure out my compass for how do we move from hard to very important and meaningful. And that was really the pivot for me, starting to work in healthcare and realizing how crazily broken it was, how much need there was for technologists who truly could dive into the domain and complexity, understand the complexity, and think from the ground up in terms of what solutions to build. And then, moved to Hopkins, did a lot of work there in AI, ML, and healthcare, and many different service lines, neurology, autoimmune diseases, critical care, quality, safety, lots of different areas through massive efforts with NIH, NSF, DARPA, CDC, most recently the FDA. But started to really, and while I was doing this work, sepsis as an example disease area is one of like many clinical areas where early detection could really change the way, we change outcomes. So was doing work in this, and then it quickly went from being theoretical to very personal when I lost my nephew to sepsis. He was in India in a hospital. I get a call and I learn that, he's in septic shock. Mm-hmm. And in my head, it was just crazy. I don't know how to, anyway.
It's a horrible call to receive. It's a horrible call to receive, and to not be able to actually do anything and just to know that there's care needed immediately.
And I think that's when it went from being like, couldn't I help the world? I want to help the world, to like, damn it, what am I doing? I need to make this happen. It's not just about like great sounding ideas. Mm-hmm. Let's translate it and show it because I know it can be done. And so we, went from there to constructing the platform, constructing a team. This is really hard. There are at least 30 teams that have died on the hill of trying to solve sepsis. I know from the very earliest papers I wrote back in 2015, there's been upwards of 800 papers written in the field following some of that early work we did in AI/ML and sepsis. And, many teams have sort of, you understand model, but you don't know behavior change. You don't understand workflow. You don't understand treatment. You don't understand how to get adoption. There's just so many pieces to it. And so just bringing it all to life together has been just such a difficult, challenging, but also rewarding experience. With the results that came out last year that you referred to, they were groundbreaking. They were so exciting to see. And then most importantly, to me, like sepsis was just sort of the front runner for these vast number of problems in what I call software driven, machine learning driven software as a medical device or software based
Right.
diagnostics. We've
Right.
had chemistry based diagnostics, hardware based diagnostics. I think there's going to be a huge emergence of these software driven tools that are going to be integrated within workflow that will aid in making real time, patient specific risk assessments that'll accelerate our ability to identify patients at risk and put them on the right trajectory, improving patient outcomes, simplifying clinician lives, and then dramatically saving us useless cost right now, where we are spending a huge amount of time in a reactive manner treating all sorts of things that don't need to happen in the first place.
Yeah. Well, Suchi, I do want to say that is a compelling, optimistic, very inspiring view of what is possible. I do think we're at the beginning, and I really do appreciate you underscoring how hard this actually is, because I think that the layperson, in the hype cycle marketing mode of where AI and ML actually are, believes that, it'll all get solved overnight. But again, the complexity of healthcare and the things that you're pointing out that need to be done are just critical. I also, I'm glad that you are a comedy fan. I think there's a little bit of comedy in your comment that you are just lazy. I didn't hear any of that when you were talking about your day. So that's a little bit humorous, humor from me. Couple more things I want to close out on you. So you've given us a really great view in terms of what's possible. And Suchi, I appreciate the work that you're doing. You're breaking ground in a way that is important for the entire industry. And there's a lot more of people who will learn from you and follow the way you're going about the work. And so I want to thank you for that, because it is important. And I too am hopeful that we can get to those types of outcomes that you're looking for. A couple more rapid fire questions. With all that you do, give us perhaps a professional low point that you learned from that changed the trajectory for you.
Oh my gosh. I feel like I have a professional low point on a weekly basis. I don't know. It's so much like managing teams is just so hard. I've been in scenarios where I feel like the vision is so clear to me. What needs to happen is so obvious. It's like, how do you get people to see it? How do you bring people along? That's a skill. That's an art. There were times when I remember this back in 2020, I think, when I was building up, the basics of Bayesian as a team and feeling like, oh my God, there are all these amazing humans who want to work at Bayesian. They have so much experience. We hired some of them, but for some reason, we couldn't be effective together. And I started to think about it and I was like, is it me? Is it the way I'm managing it? Is it the way I've brought things together? And it was like really, really hard to be in this situation where you feel like, wait, we've solved like super impossible problems, but we don't know how to solve like, human problems. But turns out ultimately the
Team
human problems
dynamics are hard.
human problems are some of the most important problems. So I feel like that was an example of just feeling, it was very hard. It was like a hard time with like the pandemic and isolation, and you feel like you're doing such important work that really needs to come to life, and it's going to fall apart if like you don't have the right people in the room and they're not feeling inspired and energized. And it was a real moment of challenge, and it was great. I had some amazing coaches who came along and helped kind of learn and observe and teach me things to think about, but also how to think about hiring. So that was like a really interesting experience. I feel like pretty much every moment of growth has started from a moment of feeling hopeless. And and I have to say, even years later, I'm continuously in this moment where like, I remember when I was in school, like in college, where one of my very, very, very dear loved advisors at the time, who was like an early pioneer in AI, I was working with him. It's like 16 or 15 or whatever. And he basically was like, I don't think you should go to grad school. And I was so disheartened. I sat there and I was like, is it because he doesn't think I'm smart enough? Is it because I can't do it? And, why is he thinking this, right? Like, it was like so difficult to hear it. But lo and behold, like, all my time, like, I have a endowed chair at Johns Hopkins. I was one of the youngest professors to receive that and have received a ton of awards in the field. And all I'm really saying is I feel like despite, like, it feels like there's always this low moment, and the thing you have to do is to find the high moment to, just figure out a way to get over it, and then
Low
figure out
moments.
who's going to help you.
The low moments do fuel growth. Suchi, this is such a great conversation. I so appreciate you sharing all of this information with us and the audience as we close out on inspiring women. Maybe not advice for other people, but I'd just love to hear, in the next 5 to 10 years, what is your optimistic view of what is possible in healthcare?
I honestly think that it's possible for us to, we're continuously every day talking about how providers are burnt out, practicing healthcare delivery is so hard. I am really, really excited. My personal chart starts with x-axis is time, is y-axis is clinical impact had. And so my real hope is, not just in sepsis, but across 10, 15, 20, 30 areas, we'll get to a place where we will have measurable impact in how these kinds of AI-driven technologies are doing early detection, timely improvement in outcomes, reducing diagnostic errors, saving clinicians time, reducing healthcare waste, right? I mean, it's very measurable. It's very doable. This does not need to be futuristic. I think the work is happening now. I can already see results in many, many areas. And I can see a generation of new entrepreneurs who are really excited about this and are making it happen. So I don't really see any barriers other than just doing it, one foot in front of the other. Let's do it, guys.
Every single day, starting at 7:30, ending at whatever comedy show is on in the evening. Suchi, thank you so much. This has been an excellent conversation on Inspiring Women. I have been speaking with Dr. Suchi Saria. And Suchi, thank you so much.
Thank you, Laurie, for having me so much. I really appreciate it.
This has been an episode of Inspiring Women with Laurie McGraw. Please subscribe, rate, and review. We are produced by Kate Cruz at Executive Podcast Solutions. More episodes can be found on inspiringwomen.show. I am Laurie McGraw, and thank you for listening.